Today is Tuesday, November 10, 2020, and we are going to be covering Module 1A on Semen Analysis. My name is Ashok Agarwal. I am the host of this program for the next 2 hours. So welcome to all of you, and we are ready to begin now. I want to declare that we don't have any conflict of interest. As you can see, the program was completely organized by the support from our center, and no companies or outside entities were contacted for any kind of sponsorship. Webcasting was supported by our Cleveland Clinic IT division, David Reichling and David Wolfley. Course faculty have donated their time for this online training. Program coordinators, and we have 7 of them who have volunteered their time for this training. And more importantly, the names, images, and description of certain products or instruments, which you will see during the lectures, are being used routinely in our andrology lab, and we are not endorsing any of these as speakers. So today's program is going to be including Module 1A, which is Manual Semen Analysis, which you have seen in the announcements that we have provided you. I am in charge of the andrology program at Cleveland Clinic, and I'm also the director of the American Center for Reproductive Medicine. I wear a couple of different hats. I am very much involved in managing the diagnostic lab of the Cleveland Clinic, as well as our program in male infertility research in Cleveland Clinic. We are recognized as the #1 program in the world in the fields of male infertility, andrology, and human-assisted reproduction. And this is based on the number of peer-reviewed publications, based on the number of citation scores that we have, and also based on the H index. And these are the numbers that anybody can check anywhere in the world. If you go into Scopus database that rates every single researcher or author in the world. We have a large number of medical textbooks that we have written. More importantly, our program has trained over 1,000 scientists, clinicians, undergraduate students from United States and from all over the world. So I'm very fortunate to be running this program along with the very talented team of people who you will meet some of them today. I spent about 10 years at Harvard Medical School, where I was the director of male infertility research in urology at Brigham and Women's, and also an assistant professor at Harvard Medical School. So now let's talk about the program. That is enough of my introduction. So we are going to cover about the COVID-19 crisis and its impact on andrology lab. And this is the first very important lecture because I think the COVID crisis has really touched each and every one of us in every single part of the world. So if you look at it, this is the coronavirus, which really is affecting us. It started this infection. It's a class of SARS-CoV-2 virus. Started back in November, December of 2019, and it was then after a month or two declared as a pandemic by World Health Organization. According to the statistics in the last few days, there are more than 48 million cases around the world which are affected by this very dangerous virus. It's highly infectious, and more than 1.2 million deaths. Just in the United States, we have more than 10 million people who are affected by this virus. and over 220,000 people who have died in this country. Around the world, more than 218 countries have been affected by this virus, which we know started in Wuhan in China. There are conflicting reports about the presence of this virus in male reproductive tissue. We really have very little information which we can tell right now. The thing that we can say, only one study has found SARS-CoV-2 RNA in semen, while several other studies have reported no positive detection. So these are some of the studies which have been published looking at COVID-19 pathology and male infertility. So is the coronavirus one which can be transmitted through semen? Really, the evidence is not very solid. It's the presence of viral mRNA is seen in a very small percentage of infected patients, although few studies with limited sample size were performed. So the data is very weak at this time. The ACE2 receptors, which play an important role in the entry of this virus inside the cells, such as spermatogonia, Leydig, or Sertoli cell, have significantly higher expression of this receptor. And there is a possible involvement of Sertoli cells with the coronavirus, and that can lead to the impairment of blood-testis barrier. And the infected patient have been shown higher LH and lower testosterone LH ratio, which perhaps indicates a possible initial gonadotoxic effect. There are other findings which have come out in a small number of studies. Again, increased DNA fragmentation seen in COVID-19 patient due to inflammation in testis as a possible complication of this virus. Consequent increase in the levels of reactive oxygen species or oxidative stress and psychological stress due to the infection. So there are so many things that have been discussed, but the bottom line is that the evidence is very small from very small number of studies with a small number of subjects. So all in all, the data that we see at this time is very weak. In response to this virus, CDC, which is the central agency called Centers for Disease Control and Prevention in the United States, came out with its guidelines for handling and processing specimens associated with coronavirus disease. And then a host of organizations, which are professional organizations, specifically in the reproductive area, such as American Society for Reproductive Medicine or European Society for Human Reproduction and Embryology. They all came out sometimes in March, April, May, a number of guidelines, position papers, which have been continuously updated as more and more evidence and more knowledge about this complicated virus became available. So there is a number of things that they have provided in these guidelines. And in addition, the Cleveland Clinic put together a host of information in their COVID-19 toolkit on our internet. And right from the day one, they have been providing a wealth of information, guiding all the employees and clinicians and staff who are working at the Cleveland Clinic in terms of the best practice guidelines. So these guidelines, along with those issued by the Center for Disease Control, the World Health Organization, the Department of Health in Ohio, and the Cleveland Clinic, really have offered us the foundation for best practices, which have been developed by our group of staff here and employees in our andrology lab, which we are going to discuss in the subsequent slides. So from this slide onwards, the actual talk was supposed to be delivered by my colleague here, Megan Caraballo, but unfortunately she has a sickness in her family and she could not join. So I'm going to cover this part, which is the objectives of this talk is to talk about the preventive measures, the safety guidelines for patients, laboratory testing and fertility preservation that can be done during the era of COVID, and what are some of the important messages for all of you who are practitioners or laboratory professionals interested in reproductive medicine or reproductive sciences. So looking at the symptoms of COVID-19, the major symptoms of COVID-19, which appear anywhere from 2 to 2 weeks after the exposure, include fever, chills, cough, shortness of breath, fatigue, muscle or body ache, headache. So all of these symptoms really precede the actual full-blown infection. So I think those are things that we all need to know. And these are being very well explained. Here at the Cleveland Clinic, the institution created a app or an applications where the employees are required to self-screen prior to reporting to work. So this is a fairly simple app that we can all download, and we enter our information, log in, and then we report if we have any kind of symptoms. If we have no symptoms, then we log in, and that it gives you a COVID pass telling you as an employee you are clear to go ahead. You don't have any symptoms and you can go ahead and start working. So the employees are required to self-screen prior to reporting to the work. And COVID-19 pass is really intended to give the employees and staff the opportunity to reflect on their own health status as it relates to COVID-19 symptoms. If they do report a symptom, then they report, then they can go to the employee health and get proper evaluation and medication as required. The employees are also screened every single day by thermal scans in every single area of the Cleveland Clinic. They are required to wear the face mask. I'm not wearing right now because it'll be hard for me to speak, but this is my mask that I have to wear right from the time that I come out of the garage of the car in the Cleveland Clinic lot, everywhere in the neighborhood and in every single building until I leave from the premises and the area of the Cleveland Clinic. So this is a requirement. But more importantly, if the temperature shows above 100.4 or higher, then they will be asked to go to the clinical triage area and see a nurse or a physician, and they have to report. Otherwise, they are clear to work. Now, in terms of additional patient screening for scheduling and visiting, these are the guidelines that we have developed based on all the guidelines which are available. As you know, that many of these large organizations, whether it is WHO or CDC, ASRM, ASHRAE, they give hundreds of scenarios and options, but you have to choose and create something which is specific for your own patient, for your own employees, and that takes time. So you cannot just try hundreds of things. It will make everyone go crazy. So it takes time to develop things which are really customized for your own area. So here, for our patients and visitors, we ask a set of screening questions to really identify the symptoms and risk of COVID-19. The standard questions that we have are, have you been in contact with someone who has been confirmed or suspected to have COVID-19? Do you have any new or worsening symptoms of COVID-19 today? Have you had a COVID-19 viral test within the last 14 days? If yes, please provide the result. Have you traveled internationally in the last month? If yes, please provide the location. So these are questions that every single patient has to answer, and all of us, when we are scheduling a patient for an appointment within the andrology program, these are questions, but these are questions that are asked by all schedulers in every single department within the Cleveland Clinic. So these are very, very important questions, and these really tell us if these patients are symptom-free and they don't have any kind of risk, and they can be actually scheduled for a visit in a different department. Now, in terms of the preventive measures that we have formulated for employees as well as for physicians, first for the employees, to make sure that there is no risk of COVID-19, are making sure that there is a personal space or there is enough room for people to work, at least as recommended by CDC. There is personal hygiene, that employee cover their mouth when they're coughing or sneezing, wash their hands, wear face covering. They should not touch eyes, nose, or mouth. Stay home when they're sick. Use hand sanitizer when washing is not available. Clean and disinfect frequently touched objects and surfaces. So these measures are well described in the media, in all the guidelines that you all must have heard. So in terms of the specific steps within the andrology area, we clean and disinfect all our surfaces with EPA or Environmental Protection Agency's approved disinfectant prior to the first patient being seen in the andrology lab, in between and after each patient and visitor, and also at the end of the day. So in other words, you have to keep on cleaning multiple times. You have to clean the laboratories, you have to wipe the waiting areas, you have to clean the collection room. Of course, we have cleaning staff as well for bathroom areas, office and consult room, lunch room, and common space. So our employees are going around, our staff are going around and cleaning each and every area. And this is something that is done multiple times during the day using a variety of disinfectants which we are using. These are variety of bleaches which can kill all kinds of germs and viruses. So we have the more important thing is the contact wet time. This is the amount of time a surface must remain wet when you spray the disinfectant. So you do not want to clean after you spray, you let it wait. And in terms of the contact wet time, each of these products that you see and others that you may be using specify whether it is 1 minute or 2 minutes for it to soak in and do its work on the germs that are spread around or touching all these surfaces which patients or employee may be touching. So this is very important, is not only to spray, but let it soak in and then wipe it nicely. Now, in terms of the spatial recognition or social distancing, there is a 6-foot distance required at all time, and that we have pasted the signage throughout the facility as a reminder, and you will see it on the walls, on the carpet, on the chairs, in every single place to remind people working or the patients that they need to maintain this social distancing of 6 feet away from everyone. The chairs are being taped, just leaving some chairs, so there is enough space between when the patients are waiting. And also there is lab employees are spaced out within the lab. To minimize the infection, the lab should remove all non-essential items, whether it is coffee supplies, whether it is magazine, all of those should be removed at this time. They should not be kept to clutter because they will collect germs as well. Now, in terms of the hand washing, you probably heard of it, and the most important is to clean with the soap and water, and clean thoroughly, not just to clean in a very quick manner. And we have to, of course, use the PPE, which will come next. So you have to clean your hands when they're dirty or contaminated, before eating, after using the restrooms, and then you can also use the alcohol rub when hands are not visibly soiled, or upon entering and exiting a patient room. So these things are extremely important in maintaining that you can avoid any kind of infection or have any kind of touch with the viruses. So the other important feature of this is the personal protective equipment, or PPE. And the most important recommendations, which are mandatory at the Cleveland Clinic, are every single doctor, every single nurse, every single employee, every single person in the family of the Cleveland Clinic and its various hospitals, more than 70,000 people around the United States and around the world, must wear the face mask every single day at all times, every single time. They should also have protective eyewear with the protective glasses or face shield where there is a possibility of any kind of aerosol. They must wear the lab jacket or lab gown, which should be disposable, and they should wear the gloves. For the patient and visitor, they must have the face mask. If they don't have that, you can provide a face mask, or we provide a cloth mask. So the patient who are entering into our facility must wear the mask, but if they are not carrying it, then we provide that to them. Universal precaution and biological safety are very important approach to infection control, to treat all human blood and certain human body fluid as if they are known to be infectious for all kind of infectious diseases such as HIV, hepatitis B, and all other blood-borne pathogens. And we really need to use the biosafety practices for patient samples that are positive for various types of infection, COVID-19 positive patient, and also for semen cryopreservation is pump banking samples. And they should be performed under a biological safety hood, which is BSL-2 hood. This is a special category of hoods that are categorized for use for these kind of infectious conditions. And in terms of the actual types of waste disposal method, the biohazardous trash, which you see on the right side with a large container and a red color biohazard bag, at least in this country, are used for all kinds of things such as towels, linens, collection containers, condoms. And then we have pipettes, pipette tips, soil lab jacket, gloves. And then we have the sharp container, which is used to dispose, which is on the bottom of the right panel, used to dispose all glass products, needles, and metal products. So those should go into very specific containers. Once they are filled, they are locked, and then they are sent for disposal through the Cleveland Clinic biological safety disposal team. Another important aspect which has been created at the Cleveland Clinic is this 4-color coded visitation level. This really is important because current status here at the Cleveland Clinic is red, which means no visitors unless special assistance is required. Only patients should be allowed. And we in the andrology use the staggered appointment times, so giving enough time, at least 1 hour for each patient. Unlike in the previous time when we can have 3 or 4 patients within 1 hour, we changed our practices back in June of this year when the lockdown was lifted, that only 1 patient per hour. So we staggered to give enough time for the patient to arrive, go through the process of provide us the sample, and leave comfortably before the second patient comes. So there is very little or no overlap between the first and second and the third patient. And we don't allow any kind of accompanying person, the wife or family member. They should sit outside in the car, but they cannot enter within our premises to protect them as well as all the employees. So the take-home message here is really that yes, there are very few reports of COVID-19 in semen, and with a very small sample size, while other studies have failed to document this finding. However, we cannot minimize the dangers of coronavirus. It is a highly infectious virus, a very highly infectious and dangerous virus with a very high degree of fatality. certainly in the older group of patients, but also in as well as in younger patients we are seeing. So, and more importantly, we haven't really seen good studies with large sample size. So, I think prudence and precaution is really mandated. Uh, we can still provide andrology services at this time in a safe environment. We encourage the use of PPE, of personal protective equipment, social distancing, and screening of employees. Using patient and visitors mitigates the spread of coronavirus. So I believe that we have to provide the services to our patients, whether it is patients of infertility, patients who are cancer, who are the most vulnerable group, and who may have a very small fertility window. And this is the consensus of an expert group drawn from all over the world, which was published a few months ago under the leadership of Dr. Sandro Esteves. And the group actually provides the blueprint for opening up. It has been several months that this article was published, and allow andrology services to be provided in a safe, careful manner to the patient who really require these services with us at this time. So I want to thank my team here and many of our colleagues and trainees. These are many of our past trainees who came in front of the Andrology Center. The picture is in the front of the Andrology Center. And this is a picture of the Cleveland Clinic that you see here. A beautiful spring day. And one of our institution here, the big building, represents the cardiac center of the Cleveland Clinic. So thank you very much. This finishes the first talk, and you can connect with our program. We are posting daily our research activities, large number of research articles. You have free access to all these publications that we are offering. We are also sharing our latest research presented at ASRM, which is American Society for Reproductive Medicine, European Society for Human Reproduction, American Urological Association. Also, you can learn about our research opportunities and ART training, which are online ART training and opportunities to collaborate. You just have to find me on LinkedIn, Ashok Agarwal Cleveland Clinic, and you can send a request to join.